Our next presentation is by Dr. Jade McNamara. Dr. Jade is an assistant professor and registered dietitian in the School of Food and Agriculture at the University of Maine, where she teaches courses on community nutrition, evaluation, and community-based participatory research. Her research interests include perceptions of the environment, nutrition literacy, and health behavior change. She loves to include undergraduates in her research and the research project to inspire and assess health behaviors and health behavior change. Dr. McNamara received her bachelor's and master's degree in Nutrition and Dietetics from West Virginia University. She went on to complete her PhD and complete her Dietetic Internship program at the University of Rhode Island. Welcome, Dr. McNamara.
Hi, everyone. My name is Dr. Jade McNamara. I'm at the University of Maine, and I'm here to present the development of an instrument that measures perceived environmental healthfulness called the Behavior Environment Perception Survey, also known as BEPS for short. So this work was done while I was at the University of Rhode Island under Dr. Jeffrey Green. And as we go through this survey, you'll see that a lot of universities were involved. We have Dr. Olfert from West Virginia University, Morgan Folk, and Dr. Sarah Colby from the University of Tennessee, Dr. Adrian White from the University of Maine, Dr. Carol Birdbrenner from Rutgers University, Dr. Kendra Cattleman from South Dakota State, Dr. Lisa Franzencastle from the University of Nebraska-Lincoln, Dr. Nikia Brown from Auburn University, Dr. Tanta Kidd from Kansas State University, and then Dr. Carla Shelnut from the University of Florida. So, I mean, just as this conference is a huge collaborative effort between these universities, and funding was provided by the state experimental stations. So background on perceptions. Actually, I'm gonna video. Okay, so background on perceptions. The environment has shown to influence our behavior, and college campuses are in a unique position to really facilitate a healthful environment for young adults because students are typically living there and working there. But limited research about student perceptions of the healthful campuses have been done. Descriptions of college students' perceptions of the healthfulness of their campus can inform the development of tailored nutrition education programs. So we really developed this tool with the hope that we can identify where students are perceiving their environment to be healthy, but also places where their perceptions of their health environment is not healthy. Again, the objective to develop an assessment tool called the Behavior Environment Perception Survey, BEPS, measuring college students' perceptions of the healthfulness, the different domains of college campus environmental influencers of health. So really trying to capture what things about their environment are they perceiving to help facilitate living a healthful lifestyle, but what things are maybe potential barriers to living a healthful lifestyle. Okay, the methods. And this was in the development process of BEPS. We first did item generation in fall 2016, and we used roundtable discussions in Q-sort, where we came up with items and then sorted them into different categories based on the topics. For example, healthful eating, physical activity, and then also we wanted to focus on mental health resources. This was done with 10 universities. And then we went into data collection in the spring of 2017. We first did cognitive interviews with students, and I will get into more details of this, but it was for them to give us feedback on these items that were developed. This happened at 7 universities with 120 students. While we were doing cognitive interviews, we were also doing exploratory factor analysis at 6 universities with a total sample of 922 participants. And then following that, stage 2 was data collection in fall of 2017 and spring of 2018. This include data collection for confirmatory factor analysis and criterion validation analysis to see how well the BEPS items related or predicted health behaviors. Oops. Oh. And this was done at 7 universities with a total sample of 2,676 students. For item generation, this was the initial step, and it was based on existing instruments that had already been developed by the multi-state HCRC group, including BEPS and CEPS. New items were generated also by our teams of undergrad and graduate students. So at the different 10 universities, labs would sit around with students and brainstorm and discuss items that would fit into this BEPS survey. And a total of 100 items were identified. Items were then sorted and reviewed by experts at the 10 universities by construct, so healthy eating, HE, physical activity, PA, and mental health, MH. And those are the 3 constructs that we were really focused on for this survey. After the Q sort, we discarded 7 items because we felt like they fit on more than one construct. And this left 93 items selected to represent the 3 different constructs of environmental healthfulness, which again were healthy eating, physical activity, and mental health. Then we moved on to cognitive interviews. So 120 cognitive interviews were conducted across 7 universities. The cognitive interviews were recorded and transcribed for thematic analysis to assess the face validity of the items. And really, if you haven't done cognitive interviews, it's asking how we did it, at least, was we asked students to read the item or the question and then describe that in their own words. Items that participants deemed to be unclear were eliminated or rewritten to improve clarity using explicit feedback. For example, one of the things students said were to change the word cafeteria to dining hall. And we did this before the stage 2 survey was administered, which we used for confirmatory factor analysis. For exploratory factor analysis and confirmatory factor analysis, we performed these with separate samples. The EFA we conducted with 6 universities, and the CFA was done with 7 universities. And then with criterion validation, we looked to see how well the different scales, how well the scales predicted actual behaviors that students reported. And we hypothesized to be significantly correlated with the BEPS factors. So we looked at measuring the dietary, we used the dietary screener questionnaire to assess fruit and vegetable intake. We used the International Physical Activity Questionnaire to assess physical activity, and the Center for Disease Control and Prevention's Healthy Days Symptoms module to look to see mental health. We then did Pearson correlation analysis to assess the relationship between the BEPS scales and those self-reported behaviors. And we also did linear regressions where to determine whether the different BEPS scales significantly predicted college students' reported behaviors. Okay, getting into the results. So the results of the cognitive interviews, we again did 120. They were evenly split between women and men, and all participants were between the ages of 18 and 24. Again, items were removed if students considered them to be multifaceted or if the items were difficult to rephrase in the student's own words. We used them to improve clarity, so dining hall instead of cafeteria. And then one of the other items that really stands out was that students didn't understand the term food preparation equipment. They, more thought about Tupperware, where we were trying to get more at cutting boards and knives and things like that. So that was another one that stands out that we adjusted. For the results of the exploratory factor analysis, 76 items remained in the survey. Items are removed that did not load on one of the identified 6 factors. Based on the EFA results, it was showing that a 6-factor model was the best fit. And so then items were removed. They did not fit on one of those 6 factors, which ended up being about 22 items. Or if they had a low loading of less than 0.30, and that was 23 items that were removed. This resulted in a 6-factor structure with 31 items, and the 6 factors were physical activity, healthy eating, mental health, peer influence, barriers to healthy eating, and then meal preparation, which was 2 items. So taking these 31 items, we then did the confirmatory factor analysis, where we used those items and surveyed 2,724 students. They had a mean age of 20 years old, and 66.7 were female. This is also when we assessed some behavior items. So they had a mean for vegetable intake of 2.2 cups per day. Their body mass index was 24.4, 30% lived on campus, and 35.2% were overweight/obese. Based on the results of the CFA, we ended up with a 22-item questionnaire with a 5-factor structure was the best fit for the data. So that those meal preparation items, that was a 2-factor scale, fell off. And what we ended up with was a physical activity, and this is Cronbach's alpha 0.7, showing that that these items are really assessing the same construct of physical activity. And then these are the questions on the physical activity subscale. For example, there are sports intramural club available to play on campus. I feel welcome to use the recreation campus. I see people being physically active on campus. Then we have healthy eating. Cronbach's alpha 0.85, looking pretty strong. All the loadings are above 4. Some of the questions on here: my campus makes it easy to eat healthy. It is easy to find fruits and vegetables on campus. Then we have a factor that came out, barriers to healthy eating. So these were all things that we kind of were saying that makes it harder for students to eat healthy, at least. My class schedule makes it easy to eat healthy meals. So this is starred because it's reverse scored. It is hard to eat healthy because all the stress at school. I do not have enough time to pack healthy snacks for myself. I cannot afford to eat healthy. And then we have our mental health factor. Again, Cronbach's alpha 0.85. My campus has a system of support for emotional or psychological problems. There are resources on campus for a person who is in an abusive relationship. I can get an appointment with a mental health professional. And then our last one was peer influence. The people I eat with make it easy to choose healthy foods. Friends motivate me to work out. Friends have a positive influence on my physical activity. And then looking at our criterion reliability, our Pearson's correlation did indicate that there was significant positive associations between all the behavior items and the different BEPS constructs. And then this is the hierarchical regression for the BEPS, predicting behavior BMI using a subsample with complete BEPS and criterion data for stage 2 participants. So this was a total sample of 2,209. And what we can see here are the different BEPS scales. And then up here, we have the different behaviors and then BMI. So we can see here that fruit and vegetable intake was significantly predicted by physical activity, healthful eating, barriers to healthy eating, and peer influence. Physical activity minutes per week was significantly predicted by perceptions of physical activity on campus, also healthful eating, mental health, barriers to healthy eating, and peer influences. And the trend continues, it really continues on. Mental health was not predictive, however, of sugar sweetened beverage intake. And that's it. But all of them were really significantly predicting self-reported behaviors, giving us confidence that that we have criterion reliability of these scales, being important in not only being able to assess students' perceptions of their environment, but also being important in being an indicator of health outcomes. Conclusions: BEPS is a novel, brief instrument measuring college students' perceptions of the healthfulness of their environment. And really, I think about BEPS as being important because, while assessing the built environment and what's actually there is important, if the built environment is showing, or we think it's healthy and that we have all these resources available to students, but then students don't see that and don't perceive their environment to be healthy, it can kind of show the gap and help us really invest efforts into improving those perceptions and thinking about how to do that. So strengths include a strong psychometric properties, breadth of constructs. We're covering a lot of different aspects that influence health, and a comprehensive instrument development process involving a large sample from 10 different universities. Perceptions about college environments really can be used, I think, to tailor interventions to address environmental challenges that students identify. You can really identify on your campus where students are having a hard time seeing their environment as healthy, if they're really scoring low on healthy eating, or if they're scoring lower on the mental health resources, it can kind of show where to invest changes. All right, that is it. Thank you so much. And I look forward to any questions you might have.